with Mr. Paul Slavin. We're here at Digital Health Live. You've been at Everyday Health in creating a vast amount of content that impacts a lot of people. Can you tell me about your background and how you got experience in doing that job?
I came out of ABC Disney, where I had spent 25 years doing everything from being the executive producer of the evening news for a long time. I ran the news division for a long time. And I got a lot of experience in covering the news and became particularly interested in health because I think it's one of the leading issues of our time. I came to Everyday Health because of their commitment to helping people choose well, their sort of deep and abiding sense that it's our responsibility to show people better ways to live, happier ways to live, healthier ways to live.
So Paul, what is the Digital Health Studio for people who weren't in the session?
The session was largely about the role. I think we started out on the notion that technology could play a really valuable role in helping people improve their health. But I think we quickly changed the subject to the notion of personal responsibility, that people have to buy into this notion that being healthy, having their kids be healthy is absolutely critical. Then we can start introducing information and technology and tools that allow them to achieve their healthy goals. But first and foremost, we have to be community-based, we have to be socially important in order to get people to recognize and actually do something about really what is one of the most important issues of our time.
So I'm really curious to understand, like, what types of content is the most engaging for folks and how are you packaging it? And then how do you get feedback?
You know, I wish I could answer that with one answer, but it depends. If somebody comes to our content and they're pregnant, they're really only interested in pregnancy. If they come and they've been diagnosed for many years as a diabetic, they're interested in diabetes. But we also have a lot of moms who come in looking for better recipes for their kids or for their families. So it depends on who the user is, and then we try to give them what's appropriate to them. And also it depends on the platform. So our program on ABC television is specifically directed towards the people who are watching at that hour, which tend to be kids and moms interested in better eating. The content we put on YouTube is also different. That tends to be more snackable, smaller size, and for a younger audience.
Yeah, so as we're shifting to massive mobile devices deployed everywhere, tablets and things like that, the consumption patterns are different.
The consumption patterns are different. The kind of content that you put there, it's all different. What's interesting though is it's actually getting more the same. The tablet has made the television viewing experience more like the standard television viewing experience, except it's more demandable.
So where are you going in 2013 into the future?
I think from our company's perspective, where we're going is we're trying to deepen the amount of content in condition areas, because we're finding there's a lot of information once you're diagnosed with a disease, but what do you do 2 years in and 3 years in? There's less information, ways to manage chronic illness on the one side, and on the other side, we're aggressively moving into more lifestyle programming around health to try and show people how to avoid getting sick to begin with. So we're kind of working on both sides.
That's what seems like a really interesting theme that's happening here. It's a lot of preventative, the preventative space.
Yeah, but I think what's really important to understand, and what Dr. Tuxen and I were talking about, is most of America, most Americans don't embrace the preventative quality yet. You know, you go to the gym and you work out, but you're maybe 1 in 10 people.
Well, let's wrap up there, and thank you so much for your time.